Victor is a trial we're very excited about throughout the clinical trials community in treating acute myeloid leukemia in the UK and in some countries beyond, because it's also hopefully opening in Denmark and New Zealand. Victor is looking at a combination of low-dose chemotherapy with a new targeted drug called venetoclax that's internationally across a number of different hematological tumours and more recently in AML has shown particularly glimpses of effectiveness, especially in some subtypes of acute myeloid leukemia. We're really looking to see if we can improve the quality of life while not reducing the likelihood of a long-term clinical benefit in that group of patients. So it's potentially groundbreaking. All of these treatments are very much applicable to how AML is managed internationally, really. And this is really quite a conceptual trial, which is looking at comparing two completely different treatment approaches. So most clinical trials look at adding one drug and compare it to a placebo, or making subtle changes to the treatment paradigm. But Victor is really looking at completely different treatment philosophies and comparing them in a group of patients where we think the lower dose philosophy may be particularly likely to work, and then potentially broadening out that later. So that's as likely to be applicable in other countries as well. And I'm sure that the results of this trial will be quite eagerly awaited outside the UK as well. So what TAP has allowed is it's established a hub of sort of like-minded individuals to try to conceive and design and run these studies. And that's potentially taken some of the heartache out of trying to set up these studies, which can be a really time-consuming process. And I think TAP has quite successfully shortened some of the timelines, allowing us to get those trials up and running in a competitive way where we can be internationally competitive.